Let's talk a little bit about moods, right? Everybody has a bad mood, good days, bad days. When should a parent seek some professional help with maybe having a child with a mood disorder? What would those symptoms be? Where should they, obviously I think they would probably talk to their pediatrician initially, but what are some things parents can hone in on that may require further attention?
I think one of the first things to consider is this mood problem impacting my child's ability to function in the world? Is it impacting his or her social life, academics, or family life? And if the answer is yes to any of those, then it's likely that this is a concern worthy of some clinical intervention. Again, going back to the conversation about teachers are excellent observers. They often can compare your child to a sea of 20 children, nearly their same age. So you certainly ask them, are there any red flags? Do they seem withdrawn? And oftentimes where we get concerned is children who are really withdrawn or acting out. Or don't seem to be socializing in an age-appropriate way.
And is it sort of more of like a constant, you see it frequently versus, more of a transient bad mood, it didn't last very long, right?
Right.
You start to see a trend.
Sure. And I mean, every kid, the pandemic is a great example. I mean, there are some environmental stressors that can create be a catalyst for a bad mood for a couple of weeks, or difficulty adjusting because my soccer team no longer exists because of the pandemic. But yeah, that is different than something that is, there's like a through line throughout. Like, yeah, the art teacher notices it, and the last year's teacher, and that's when seeking consultation with a licensed professional, it can allow you to hone in on what the actual diagnosis is, and they'll do diagnostic interviewing to do that.
Yeah, I think you're looking often at whether there's a change in this child's functioning. If a lot of kids who were just doing great before the pandemic started to be down in the dumps, but a lot of adults were that way too. And but what became evident with time is there were kids who wouldn't leave their room anymore, and they were just pulling back, withdrawn, distressed at a completely different scale than the rest of their classmates. So we want to see, is there a change in functioning, and is it disproportionate to what other kids are doing or disproportionate to the circumstance?